We'll be able to have a little look back as well. Are you starting that recording? Oh, brilliant. Okay. All right, well, thank you for joining us today. It's great to have so many people having registered, and there are a few people still just dropping in there, which is great. So it's great to have so many of you wanting to find out more ways about reducing work-related ill health. I'm Claire Glynn. I'm the head of MSK services at PAM Physio Solutions, and I've got Nicola with me today, who's the clinical director for PAM Wellbeing and one of our mental health experts as well. So we're really lucky to have Nicola with us today. Before we start, I just want to let you know that we have put all microphones and cameras on mute while we do present, but do feel free to put questions in the Q&A facility that we have enabled, and we'll answer any questions at the end.
Perfect. So today we're here today because of work-related ill health is soaring, with the latest labour force survey showing 1.8 million people a year are going off sick due to work-related ill health. So we really want to shine a light on that and how we can help you as employers, as businesses, how you can help your employees. So the topics we're going to discuss today are what is driving the surge in work-related health, how you can identify the risks within your organisations, what can and should we be doing as employers, and how can we create a healthy working environment. So this should take around 30 minutes, and hopefully we'll have time for question and answers towards the end. So if during the presentation you have any questions, just bob it in the question and answer box and we'll get to those at the end.
Thanks, Nicola. Yeah, so the problem is soaring, so much so that according to the HSE's latest report, 722,000 people are suffering from a new case of work-related ill health, and that's in the 2021 to 22 report. So together with existing conditions, that meant that 36.8 million working days were lost over a 12-month working period. 1 in 4 of those cases are due largely to preventable musculoskeletal or MSK issues, and a further 1 in 2 cases, which is half of all cases, are due to work-related stress, anxiety or depression.
As you can see, the problem is huge, and when it comes to issues driving mental health related absence, it's very much a case of overwhelm. Our PAM latest independent study for over 1,000 employees found that 2/3 of employees had experienced burnout or fatigue, 1 in 4 felt stressed, and 7 out of 10 felt anxious. And in the short term, stress can be a good thing. It motivates us, it gets us up in the morning, it challenges to meet deadlines, but prolonged stress can take a serious toll on our mental health. And chronic ongoing stress has been linked to conditions such as anxiety, depression, post-traumatic stress, substance problems, sleeping difficulties, and in the long term, they can have effect on our memory, our self-esteem, our concentration, which in turn has an effect on us as an employee and may lead to us needing to take time off work. We also asked employees what they want to stay healthy in the workplace. So 2/5 said a healthy work-life balance. 1 in 3 say a supportive manager that helps them stay healthy, and 1 in 5 value access to mental health support. And then unfortunately, in reality, the vast majority of employees do feel unsupported, with most saying having little or no support or unsure how to access that support once they get sick. And I guess that's something we're going to cover today, that when individuals go off sick, that's when they feel that's when they need to access support. But really, as a PAM wellbeing, we want to be proactive and drive that support before individuals become sick. So they are the key drivers and issues in the workplace, and hopefully we'll be able to cover that for you today.
So in the MSK world, we know that there are 4 key common risk factors, but what is driving the prevalence of these MSK issues? So, backed up most recently by the work-related musculoskeletal disorders statistics in Great Britain for 2022, we already know and have known for a long time that fixed or constrained body positions, whether this is awkward or organic body positions, if you sustain any position for a long time, you're leaving yourself susceptible to functional aches and pains. We know that continual repetition of movements and excessive force, sustained or repetitive, are detrimental, and a pace of work that doesn't allow for sufficient recovery between movements all contribute to potential MSK issues. Additionally, workplace biopsychosocial factors such as organisational culture, the health and safety climate, and human factors may create conditions for work-related musculoskeletal disorders to occur. Generally, none of these factors act separately to cause issues, but they can go missed. As a result of the prevalence of these issues, 1 in 4 employees has experienced MSK problems. The majority of physical issues causing someone to go off sick, as you can see, are primarily back pain, followed by upper limb issues, and then followed by lower limb issues. Another consideration when it comes to preventing these issues is that according to the Health and Safety Health at Work survey, 1 in 2 employees have been affected by delays accessing the NHS, unfortunately, and 1 in 10 of the population of the UK seeking medical support has been extremely affected by a cancelled operation.
It's also worth noting, Claire, isn't it, that MSK and mental health issues are often connected. If someone's in pain, waiting for treatment, this will start to affect their mental health. And if someone's stressed and tense, that can also affect their neck and shoulder strain.
Absolutely, very much working together.
So in terms of mental health, what can employers do? So Deloitte recently did a study and found that for every £1 invested in proactive mental health solutions, employers could save £5, not only in sickness absence, but also in saved management time, replacement staff cover, training, and recruitment costs.
And when
And
it
I always
comes
think,
to
sorry, go on.
carry
You go
on.
on. You go on.
When it comes to musculoskeletal issues, there can be a tendency to have a health and safety team complete a risk assessment, and then that gets filed away without going any further to necessarily put in place any easy measures that actually reduce the risks to employees. It's like getting a prescription from a GP to fix a problem, but they're not filling it or taking it.
Yeah.
And employers do have a legal and moral duty to provide a safe working environment, yet 2/5 of employees say that work has undermined their health or made them sick.
And that's a really, really interesting point, Claire, because just like with MSK, there are risk assessments for individuals for stress and mental health as well. So HSE defines stress as the adverse reaction people have to excessive pressure or types of demands placed upon them. And as a manager myself, I always think that's a real key term in being demand placed upon them, meaning we have the power and control as employers, to identify and reduce the risk. Therefore, being proactive and completing a stress risk assessment with employees directly will help them and us identify and manage the causes of stress at work. Sorry, I've got a real sore throat today. We can also, as a management team, follow the 6 management standards set out by HSE, which can be used as a guide, which allows us to identify any hazards within our business and steps we can take to control those risks. And this can be part of the overall wellbeing strategy rather than used as a standalone completion. Employee wellbeing is also good for our people and our organisation. Promoting well-being can help prevent stress and create a positive working environment, which I'm sure we're all eager to do, wanting to attend today. So policy is a real key place to start. We're setting out a commitment to our people and making it very clear and what it includes. So some of the things we can include is ensuring that it's being championed by senior management, outlining the responsibilities and the key stakeholders of who is going to take responsibility for what, including other professionals such as occupational health and employees at the forefront. Within that policy, setting out clearly what is available to our employees, the support, the training, and any other wellbeing employee initiatives and support you have in place. incorporate the process of evaluating the effectiveness. And this is key when we look at the case studies later on, that it's all well and good having a statement, we can say tick box, we've said we're going to commit to mental health for our people, but it's having that continuous review and seeing how effective those initiatives are and setting the date ahead of time so that we're committing to reviewing that. It's also important for our senior leaders to really role model the healthy behaviours they'd like to see. So a simple example of that would be how many people on this call will skip a lunch break, or how many people in our teams do we see skipping a lunch break. So as leaders, it's really important that we take our lunch break, and that encourages team members to take them too. So I often have the analogy that it was the other day, I was like, I really, really need my dinner. And like, I really, really wanted dinner. And one of my team was like, I rang them after my dinner and they answered. And I was like, are you eating? They were like, oh, yeah, it's fine. I was like, absolutely not. Like, it's your lunchtime. That's fine. I'll call you back later. But they were happy to take that call from me. So I really needed to set that boundary that their lunchtime is their lunchtime and they don't need to answer that call from me. So it's really important to model that behaviour. Another way would be to look how we're promoting the services available to our people. So often it would be on an intranet or discussed in induction, but that can go missing, if it's in the depths of our intranet, sorry, and we're talking about different initiatives all the time, that someone might not be able to find that when they really need it. So communication is key, continuous communication to our employees, perhaps looking at a wellbeing calendar within the 12 months and having those different events on a monthly basis, and within those different events telling them exactly where they can get that support. So, for example, this week is Children's Mental Health Week. So we would, in February, send out a mailer of children's mental health, some top tips, some helping, but within that also where people can get help from the services that we've put in place, but external services too, so that we're communicating that on a regular basis. So in 3 months' time, I may need that for one of my children. I know exactly where it is that I would look for that support.
So there are three key things that you can do to reduce the risk of employees developing an MSK issue through work. The first is to identify the potential risks, and then we're going to try and make it difficult for people to hurt themselves, and that might be through designing out risks or driving cultural change. So how do we identify the risks? This can be through a formal or informal risk assessment, or by talking to the teams that perform the tasks, reviewing organisational accident history or internal absence history, or maybe asking an external ergonomist to complete a full review of the working and workplace task demands. There is a legal obligation to carry out risk assessments and subsequently provide employees with advice, education and instruction around workplace task performance, but that is just not enough. Sometimes you might have to change the culture or design out the risks. So we worked in a food manufacturing plant some years ago, and the issue that they were having was that the teams employed transferred incredibly heavy sacks of ingredients into mixing vats, weren't performing the desired two-person lifts or using the ceiling operated suction lifters that were put in place to help them. They were instructed to use these facilities to make the task easier, but they were lifting and transferring in one-person lifts. And even though this was causing injury, there was an ingrained culture of being a big, strong employee that could do this task and do it quickly and without help. So this was despite regular instruction and training and education, and even the introduction of disciplinary actions. So the ergonomic advice was eventually to design out the risk, make the sacks of ingredients so heavy that it's physically impossible to perform a single or double person lift. The sacks almost overnight were converted to 125 kilo weights, and the teams were absolutely forced to employ the ceiling operated suction lifts. So that was a great result.
Wow, the same goes to mental health, doesn't it, Claire? That it's not good enough just saying to people, don't do this, you need to use these tools. We really need to, as you say, design that out and lead by example and put those mechanisms in place for all employees and leaders in the organisation.
That's right. And
so for no, I was just going to say, so for mental health, as the design out that you use for the MSK, that in mental health, we might put a policy in place or software that prevents unhealthy working patterns to protect our people's mental health.
And furthermore, talking about designing out risk, we are working also with an energy company, and we're looking at all ergonomic risk factors, from the impact of lighting, noise, humidity, and those can impact mental health as well. So we're looking at also then from the ergonomic perspective and physical perspective of the different heights of where people are sitting within a designated space. So taking everything into consideration.
Perfect.
So easy solutions to reducing the risk of musculoskeletal conditions arising are about considering these initial 5 key features. Improved work techniques. Establish the best way to complete a task whilst recognising the goal of decreasing risk factors. So, for example, employ beneficial mechanical or automated equipment, such as conveyors, lifts, dollies, carts, forklifts, platforms, all in order to mitigate mechanical injury. Proper preparation for the working tasks through stretching and a warm-up. Workplaces can support warm-up practice. This incidentally can also provide the opportunity for team bonding and communication, whilst, as we say, preparing each employee for the physical demand of their roles. PPE is designed specifically to reduce the risk of injury. For example, shoulder, elbow, knee pads, vibration reducing gloves. These create a positive influence on physically demanding tasks. So hand tools are intended to reduce applied force, and they must fit the job that they're employed for. So using the wrong tool can cause irritation and potentially long-term side effects. Attention should be given to how a tool is operated by the user. So this means that training does remain important. Knowledge of the risks of performing a task shouldn't occur on the job, but actually be considered before task completion or commencement. So knowing how to make an autonomous ergonomic change in order to prevent your own MSD, musculoskeletal disorder, will support independent positive behaviour changes. We just want to share this example with you. EKFB is a joint venture of 4 civil engineering and construction companies responsible for delivering 80 kilometres of Britain's new high-speed railway, HS2. So as well as reducing occupational health risks, EKFB wanted to create a culture that supports the physical and mental health of the 4,500 people on site. So working in construction and engineering can be very rewarding, but it's also very challenging. Workforces in construction work in roles that expose them to risks such as dirt, noise, and vibration if the proper precautions aren't in place. There's also a lot of manual work using specialist machinery in all weathers, and often living and working away from home, which can be emotionally challenging, and additionally limits access to healthcare. So PAM supported by proactively educating employees about steps they could take to not only protect but also improve their health in a whole person approach, covering everything needed when it came to reducing risk and boosting physical and mental health. So we provide an occupational health hygienist who monitored employees at work and provide detailed advice and reports on how they could reduce health risks. And additional proactive PAM OH services included a dedicated on-site clinical team to drive wellbeing initiative, a virtual GP service, physiotherapy, and education on reducing the top 5 health risks in construction when working at an EKFB location, as well as dedicated wellbeing sessions for everyone on a variety of topics.
The mental health services included face-to-face, telephone and video access to PAM's dedicated counsellors through our employee assistance programme. We provide like confidential support, education on the issues ranging from managing stress, financial worries and relationship breakdowns. And the results were great for EKFB. 83% of people felt more equipped to discuss their mental health. Employers felt supported to be them as healthy as they can be, and they proactively supported to stay and work through the OH programme. And another example would be Cura. So if we look at the case study today, we'll look at the challenge they were facing and how they overcame that challenge with some really real practical steps and influencing the culture of their organisation. So Cura are the UK's largest outsourced customer service centre. So they've got 2,500 employees. And as you know, contact centres can be especially stressful for employees who are speaking with customers and helping solve their daily problems. These environments can be intense and emotionally draining, and many advisors deal with customers experiencing distressing personal circumstances. Employee health has been in the spotlight over the last 2 years, as you know, and Cura had a lot of measures in place in the first instance to support employees. So that goes back to then analysing what we had in place. So when they analysed, their data and research showed that 34% of work-related ill health was a result of stress and anxiety, and Cura felt they could do more and do better. During the pandemic as well, they also had a lot of new starters that started the organisation working from home and found themselves living and working alone without immediate support of their colleagues and managers when dealing with difficult and vulnerable callers. So in response, Cura worked with their client base to reduce the likelihood of upsetting calls and decided to develop the management team to advance their skills needed to support their advisors. So in their approach, in addition to contacting their client base and making some changes there, Cura invited PAM Wellbeing to review their data together and create a 3-year wellbeing strategy. So this meant that Cura were to enhance their existing counselling their services through the EAP by adding cognitive behavioural therapy, eye movement desensitization and reprocessing, so known as EMDR, and introducing the PAM Wellbeing app, PAM Life, to create a holistic approach in addition to training for managers. So this was a real focus training for the managers, which included mental health awareness, how to have supportive conversations, diversity and well-being, and building a positive culture. So what was their solution? Each module was designed and developed by the PAM Wellbeing clinical team in keeping with Cura's values, and that was really important when creating the program, that the PAM Wellbeing team really understood the values of the organisation to make that fit for them, because not one size fits all. So almost 250 managers in Cura to date have received this training, and Cura has seen a real positive shift in the business culture and the quality of their relationships, which has made the advisors feel more cared for and remain loyal in the organisation. So once managers who were concentrated and focused on output and targets of the contact centre, they're still doing that, but have been reminded of the more human side of leading a group and when conversing with people, which has helped them develop into more empathic, effective leaders. So we'll go on to touch. So that was a real great example of what we can do as an organisation that already had something in place, but why it was important to really look at what was in place and what was to offer. And culture is extremely important with an organisation. So as you can see, the training and services that we put in place had an overall effect on Cura's culture, and that had an impact on how employees then experienced their workplace and how they felt supported. And values and behaviours are at the heart of an organisation and their people. When truly embedded in an organisation, they enable individuals to feel part of the bigger picture, more engaged and less overwhelmed with tasks at hand. So by doing this, we're creating a psychologically safe workplace consisting of behaviours, commitment and actions. You can do this by promoting conversations around different issues in the workplace without fear, judgment or blame. Be curious to ask employees lots of questions to encourage them to speak out to you, and be vocal that it's okay to make mistakes, but not just say it's okay to make mistakes. Show them, own it, that it's okay to make mistakes. Share when you maybe have made a mistake and what's come of that and how that is okay. Because we're all human and we need to reduce that fear for individuals. Commit to an open door policy and be open to constructive feedback with solutions. And it is inevitable that employees are going to have a bad day and at some point in their working life feel the impact of work-related stress. But if leaders create a sense of dependability and belonging, this allows employees to be proactive, to have an open conversation earlier on in their stress levels before it comes too much at work. I know, for example, if I'm having a tough day, for whether it be work or home, I would be able to pick up the phone to my boss and say, oh, I'm having a really tough day, and talk that out and move forward from that, which actually gives me a sense of lifting that weight off my shoulders. So with everything we discussed today, I think it's really important to have a holistic strategy in place necessary to support our workforce, which in turn will help reduce the impact of poor MSK and mental health in our people.
So let's look at 3 ways that employers can improve their provision. Strategy. You need to have a look at your data, and we can support with that. You need to know where your hotspots are, what your employees and workforces are saying, how your managers feel that they are equipped to deal with the issues that they are faced with in their teams, and then work collaboratively to establish easy and simple ways to overcome any of these barriers. Workshops. Workshops are different for managers and employees, but being able to provide that information for people for how to better look after themselves psychologically and physically, and how to access the support that they do have access through the workplace, is incredibly important. So access to services, we do have physiotherapy helplines and our own PAM Assist EAP, Employee Assistance Programme, but you guys and your employees are likely to have access to something similar as well. Do your employees and do your teams and workforces know how to access those, or do they need that extra prod and information about it?
Thanks, Claire. So that is the end of the training session today. So if anyone has any questions of what we've talked about, please feel free to put that in the question and answer. I know when we put the meeting invite out, we did ask for questions beforehand, and we have had a couple of those in. I think, Claire, the first one's for you, so I'll ask you that question. So the question that came in before the webinar today is that we don't have the budget for any expensive initiatives right now. What would you suggest?
Well, the great thing is that often the answers when it comes to reducing musculoskeletal health risks is that the best and most simple things are usually the right answer as a starting point. And, you know, asking the workforces about what's going to be best for them works really well. So we use an activity called body mapping. And body mapping is a technique that employers and workers representatives can use to gather evidence from groups of workers about the effects of work on their bodies, such as musculoskeletal aches and pains. So consulting with the workforce and their active participation is essential to ensure adequate measures that are chosen to tackle any identified problems are actually effective. We like to use this and get individuals, we facilitate individuals talking to each other. So an example is that we visited a local authority, probably last year it'll have been, and there were lots of individuals working in the garden areas that were experiencing quite extensive difficulties with their upper limbs due to vibrations and machinery. And whilst they were all talking to each other, one of the individuals expressed that they were having lots of difficulties, but then they were told about a set of vibration absorbing gloves, and they've been using those for probably a couple of years by that point, and had found that their issues had gone away. So the rest of the people then in that activity went away and got a pair of those gloves. Now, if I'd have stood at the front and said everyone's going to start wearing these gloves, I'd have been enforcing something, and that wouldn't have worked. But because these individuals told themselves and they're experienced in their job role and they know what they're doing, that's had a fantastic effect on their abilities. So it's just those simple things. Let the people speak to each other whilst facilitating it, so it doesn't turn into any kind of slanging match. And it's the little things that work that are really inexpensive but are very cost effective. I think we did have another question in as well.
Yeah, I was just going to add that actually is similar for mental health, that we've seen with organisations that we've worked with. When they have people come forward and share their real life stories, it means more to individuals when it's a colleague or a friend, and when they've the success of reaching out for support and how that helped them, how they've moved forward and found a solution, or just felt really supported. So sharing those stories amongst each other, or some organisations have gone out to individuals and asked them for their permissions to share an anonymous case story, and you'd be surprised how many people are actually willing to share their story and their journey to encourage others to use services as well.
Excellent. Yeah, very much so. So there's no new questions turned into the Q&A box yet, but we did have a second question. So the second one's actually for yourself, Nicola, fortunately. We think we're doing a lot on mental health, but our employee survey showed people don't feel supported. Where are we going wrong?
Yes, it's start by looking at what initiatives you have in place. So review what you have, how and when they are being communicated through the organisation. We don't just want to be talking about support when individuals may be at breaking point. We want that to be at the forefront of the company culture. And I guess I can't stress that enough, how important company culture is. We might have all these amazing initiatives in place, but if we don't have the safety within our workforce to access these things, then they won't access them, which may be where the sticking block is, or they might not be able to find them. In some cases, there's too much, and they may not be in sync, so they might not be in like a well-being hub, for example. They could be in different parts of an intranet page or different parts of a manual, or just never spoken about. We could launch something and it launches really well, and then in 6 months' time it's forgotten about because another business priority comes up, and that's why it's important that the well-being is then embedded as part of BAU in a business, rather than being something that we add on or we do at a certain time of year. And knowledge is power, so by sharing what our services can do or how we can support people, then employees will be talking about that on a regular basis and know exactly where to look. And that managed training and manager support is so important, and not to put that added pressure onto the manager, but just so they know, and talking about it with their team on a daily basis too.
Yeah, and I think worker participation is such a simple process between employers and their workers and representatives that, engaging in those principles is incredibly beneficial. Talking to each other, listening to everyone, learning from it, and then acting on it, sharing views, and doing it all in good time as well. And that ability to make decisions together then puts that trust and respect into an organisation, doesn't it?
Absolutely. You feel important and invested in, don't you?
Yeah, absolutely. Okay, so we've still
Perfect. So I can't see any questions.
Yeah, still no Q&A, but obviously thank you so much to everyone for joining us today. If you do want a copy of the presentation or a one-to-one chat, please do feel free to get in touch if you do feel that your organisation is facing any challenges. We will hang around for a
Thank
few
you
more
so
minutes,
much, everyone.
just in case anyone does pop any questions up. Oh, we do have a hand up.
Can you unmute?
There, Kathy, I think you're unmuted, Kathy. Have you got a question?
Oh, sorry, we're still
Mike, there you are.
I was trying to put a question in the chat actually, but for some reason it's disabled. It won't let me put anything in there.
Oh
no, right, hang on. That was not the intention. Sorry about that. Hang on.
It was more a comment as much as anything, but I was interested in the concept of stretch before work, because I think so many people in physical jobs seem to think that their job is the only exercise that they actually need to do, but then a lot of them are experiencing pain or injuries, and I think a lot of that is because of sort of general poor body conditioning. So I think that it's quite an interesting concept. If that could be built into more workplaces, I think it would go a long way to sort of help people.
Yeah, it's incredibly common. Obviously, I'm a physiotherapist by background, so I spent a lot of time in consultations. And when you ask that question, when you're in a physically demanding organisation, you say, "What do you do to keep yourself fit and healthy?" Their answer is, "Well, I do this job." And then, we spend a lot of time trying to incite positive behaviour change of going, well, actually, if the only health and fitness you do is your job, you're actually over capacity whilst at work. You shouldn't be working at full capacity. So it's a massive, culture change, education change, behaviour change, and getting people to realise that actually they need to be healthier outside of work, so that in work it's easy, however physically demanding it is.
That's it. I do 20,000 steps a day, so I don't need to do any more exercise.
You sound like a postman.
Not me personally, but that's what people tell me working in houses, because that's what they do.
Yeah.
That was really interesting. Thank you. I think everyone else has left. It's just us, but there we go.
Yeah, thank
Well,
you
we've
so
kept
much,
it recording,
Kathy.
so I hope that's okay.
Thank you.
Thank you very much.
Cheers.
Thanks,
Bye-bye.
Kathy. Have a good day. Bye.
You too. Bye. Thank you.